Hello, everyone, and thanks for joining us this morning. My name is Meg Drexler, and along with my colleagues here at Community Business Bureau, we're delighted to welcome you to the second webinar in our series as part of the ILC Ready program, our new program for community organisations who want to build their skills in planning projects and applying for funding. Thanks to funding from South Australia's Department of Human Services through its NDIA Community Inclusion and Capacity Development Grant, the ILC Ready program is free. Joining us today, we have people from all kinds of organisations, big and small. We have experienced grant applicants and people who've never done a grant application before. This webinar, and indeed our whole ILC Ready program, is for all of you. If you are experienced, some of the information we present today might be familiar, but do stick around because we'll be sharing some new stuff too. And you'll also have the chance to share your knowledge in our interactive Q&A. Before we get started, I'm going to share some tips to help you get the most of today's webinar. First, sign up. If you are watching today but didn't register yourself, you can do so by clicking the link at the bottom of your screen or visiting cbb.com.au/ILC. If you know anyone else who'd like to join us, please feel free to share that with them too. This is an interactive program, so the more people get involved, the more we'll be able to learn together and from each other. Today is just the start. Still to come, there is one more webinar in the series and a full-day live workshop touring South Australia next month. There's also the opportunity for South Australians organisations to apply for individual support from our consultants to develop a proposal ready for future ILC grants. More on that later. On your screen, you'll see some tools that will allow you to interact with me and the other people attending today. At any time, you can write a message in the chat window at the bottom right of your screen. That will be seen by everyone and will also be viewable on a recording of this webinar that will be published on our website. If you don't see your chat window, you might just need to click in the bottom right-hand corner to make it pop up. My colleague Kirsten Tate is moderating the chat today. Hi, Kirsten.
Good morning.
So if you have any technical questions, you can write a message to Kirsten in that chat window there. You can also post a question. There are two ways to do this. Click or tap on questions at the bottom of the screen and you'll see all the questions that have been posted. You can vote for the questions you like answered or add your own. If there's something in the chat that you think would be a good question, you can add that by, in the chat window, hovering your mouse over the question and clicking the question mark. If email is more accessible for you, you can also email ilc@cbb.com.au. Kirsten is watching our email and will be able to see your response and share it with the group immediately. We'll answer as many questions as we can in about 40 minutes' time when we start our live Q&A. Joining me today is Leah Spaven, Local Area Coordinator at Baptcare, and you'll have the chance to ask me any of your burning questions about the real life experience of developing and running an ILC project, and Leah, any questions you have about LAC. So we hope you enjoyed today's webinar. Remember to get the most out of today, ask questions and vote for your favourites. In today's webinar, you'll learn about how to take an ILC project from just the seed of an idea to a project that delivers outcomes. We'll be looking at what the NDIA is looking for in an ILC grant project, including the investment principles that guide the ILC grant programs. We'll hear about how SA organisations, big and small, have turned their ILC ideas into grant fundable projects by using their strengths and also the power of collaboration. We'll look at how the NDIA assesses grant applications and what they're looking for. In our last webinar, we looked at the big picture of the ILC and all the detail about the 4 new grant programs. If you missed that, you can catch up. Visit cbb.com.au/ILC and click webinars to get a recording or transcript. First, a little refresher. 4.3 million Australians live with conditions that, if unsupported, cause disability. That's about 1 in 5 of us. So disability is actually very common. Everyone has a part in making Australia a place where everyone has a fair go, regardless of their ability. And for that reason, funding for ILC projects is open to organisations and businesses of all kinds who want to make Australian society a better place, a fairer place. ILC is an important part of the National Disability Insurance Scheme, or NDIS. The way the scheme works is many people with disability will get support from the mainstream systems we all use, like healthcare and education, and from informal supports like friends, family, and community groups. Some people need more specialised support. They are the 460,000 Australians who will have an NDIS plan. People can use the funds they're given by the government in their NDIS plan to buy the supports they need to live well from anyone they choose. The NDIS has partners in the community. In South Australia, those partners are Kudos, Baptcare, Mission Australia, and Feros Care. These organisations are the first point of contact for any of those 4.3 million Australians with a disability looking for help. The NDIA also provides ILC grants to organisations and businesses to do ILC projects in their communities. That's what we're talking about in this webinar series. If you would like more information about ILC, which stands for Information, Linkages and Capacity Building, again, catch up on our first webinar. So the ILC grant program exists to invest in making our communities, services and workplaces more inclusive. But what does that actually mean? And what on earth has this rather strange image that you see have to do with that? Both questions are answered really, really well in a short video that you can watch later at www.notspecialneeds.com. In the video, we see people with Down syndrome talk about the idea of special needs. It would be special if people with Down syndrome needed to be massaged by a cat, or eat dinosaur eggs for breakfast, wear a giant suit of armour, or be woken each morning by a celebrity. But they don't. People with Down syndrome, just like everyone else, have basic human needs: to eat, drink, breathe and sleep, to be nurtured, loved, educated and sheltered, to move, communicate, contribute and work, and to share, love and live. Sure, people with Down syndrome may need extra assistance. Sometimes they may even need significant assistance and adjustments to meet a particular need, but that doesn't make that common human need special. Those are the words that you'll find on notspecialneeds.com. The point is that no matter what differences we have, everyone wants the same basic things out of life. And inclusion means making a society where that's equally possible for everyone. That's what the ILC is for. The NDIA's ILC grant strategy towards 2022 has 4 programs: the Individual Capacity Building Program, the National Information Program, the Mainstream Capacity Building Program, and the Economic and Community Participation Program. We had a close look at these in our last webinar. Now we're going to look at each of the 5 investment principles that sit behind each of these programs. The slide you're seeing now is taken from the NDIA's ILC strategy towards 2022 document. So if it's a little difficult to read on the screen, you can read the full document at the links we've posted on our website. And I think, did you just post one now, Kirsten?
Not yet.
No. On our website. Oh, you've posted Not Special Needs. Excellent. That's there for you later. In each of the ILC grant programs, the NDIA is looking to give grants to projects that are evidence-based, meaning that they answer a real need using a solution that's likely to work, that are led by people with disability and their families, that are replicable and scalable to national impact, meaning that they're ideas with legs that could be used in different places or made bigger over time, and that support a sustainable NDIS, meaning that the projects help prevent people needing specialised support from an NDIS plan, for example, making mainstream services better or preventing conditions getting worse. The final investment principle is activities that support important groups like Aboriginal and Torres Strait Islander people, people from different cultural backgrounds, or CALD, CALD, people who are lesbian, gay, bisexual, transgender, intersex, or questioning, or people in regional and remote areas. Let's look a bit closer at each of these investment principles now. When you're given an ILC grant, you're trusted with public money, money that belongs to all of us. So the NDIA, as a government body, is looking for projects that are most likely to solve a real problem. They'll also want to know who will be helped, where, and how many people, and that there's evidence that the things your project will do are likely to make a difference. An example, the City of Playford is a local council in the north of Adelaide. In this area, there are many people with disability and many people from different cultural backgrounds. All of them come to the council for help with many different things. The council has social groups for people with disability. They also have free internet access at the Civic Centre so that anyone without access at home can come in to connect with government and other services online. They noticed that people with disability from different cultural backgrounds were having trouble getting help. That's the first step in evidence, noticing a problem. Once they noticed a problem, the City of Playford started to small technical glitch. The City of Playford started to dig deeper to research the causes of the problem. So research. When you think about research, what comes to mind? Perhaps statistics and surveys? This type of quantitative research is great at measuring and defining things: who, how big, how many, and how much, but not so great at finding out what or why or how. For that, you need qualitative research. This is the type of evidence gathering that helps you get clues about what's really going on, why, and how you might go about making things better. Qualitative research can be done formally, for example, with focus groups and professional researchers, like the study we saw that Incl did with Flinders University in webinar 1. But it can also be done simply through careful and objective observation. That's what City of Playford did. They walked with people through every point in the process of trying to access services and noticed what they saw. They noticed patterns in the types of problems people were facing. The pain points included cultural barriers. For example, in some cultures, it's usual for a woman to have her husband present if meeting with another man. So male staff might find the door literally closed. Language barriers. Interpreters were sometimes difficult to access, but even when they weren't, much of the language around disability includes concepts that don't easily translate to other languages or cultures. And then there were system barriers. With so many different services, it can take some persistence and knowledge of our systems to get to the right place. They then tested their assumptions by reaching out to other councils in the north, the local office of the Department of Human Services, to find out if they'd noticed the same things, and they had. Together, what they realised was that all these pain points had something in common. They were happening at the front line and across lots of different service systems. To make a change, City of Playford, City of Salisbury and the Department of Human Services decided to work together by applying for an ILC grant to create a CALD toolkit for frontline staff working across different social services. CALD again stands for Culturally and Linguistically Diverse. Their aim was to empower the first person in the front line to work around cultural, language and system barriers so the person would get the help they needed the first time. Having understood the problem to be solved, they needed to show the benefit to the community in solving it. For that, you need to be able to show the size and scope of the problem. First, they looked for published research for evidence. They found the research that Baptcare and Flinders University conducted. They also looked to the relevant peak body, FECA, the Federation of Ethnic Communities Council of Australia, for their existing research. Both universities and peak bodies are really good places to start looking for research to evidence the scope of a need. To size the need, there are online tools that will summarise published demographic data for you from reputable sources like the Australian Bureau of Statistics. These tools even make charts and graphs you can copy, which is great help if you're not a data whiz. Kirsten's going to post some links to some of those now. Our favourites include the Social Health Atlas, which tracks health and social factors nationally and by geographical area. Profile ID, which collates demographic information for specific locations. And there's also the NDIS demand map that gives you information about predicted demand for NDIS services. But sometimes it's difficult to get accurate data when you're looking at a very small population. So the City of Playford and their partners also looked to their own systems for data about the frequency of the problem. In combination, they had a good case. The final piece of the evidence puzzle: how will what you're proposing to do make a difference to the problem? Well, you can use evidence that similar approaches have worked before. An example of that was HCO's project that we talked about in webinar 1. That approach had good evidence behind it already. Or your evidence might come from your organisation's mission and the consultation that you've done as part of your usual business. An example of this is Inclusive Sport. Inclusive Sport SA exists to create an inclusive culture through sport and recreation. Their ILC vision, a future where someone living with disability sees a sport on TV that they want to play, they can access that sport on the same basis as anyone else. To achieve that vision, sport and recreation clubs need to know and have confidence in what to do to include everyone. And people with disability also need encouragement to get involved in mainstream sport for all the social and health benefits we know that that provides. So Inclusive Sport designed a project to deliver against 2 of the ILC's outcomes, as well as their mission. Those were that people with disability use and benefit from the same community activities as everyone else. And the second ILC outcome, that they have the knowledge, skills and confidence to participate. Inclusive Sport already had plenty of evidence of the benefits that being part of sport and recreation provides for everyone. Through their work, they also had a good understanding of the barriers against inclusion of people of all abilities in mainstream sports and recreation. One of the main challenges happens again at the front line, when people in community sporting clubs are unsure about how to include people with different abilities and concerned about doing it right. The result can be that nothing is done for that person with disability and they end up leaving the club. This knowledge helped them to design 3 activities to deliver against those outcomes for the community, for the sport and recreation sector, and for people living with disability. Now, you notice that as we're going on, Kirsten's posting a whole heap of links here. If you are watching live, I encourage you to stick with us because they will be available in the recording immediately after today. For the community, Inclusive Sport are running a campaign to make the participation of people with disability in sport seen as ordinary life. Last month, a survey was distributed to 10 mainstream sports targeting general club members, parents and participants to gauge a benchmark of what the current attitudes are in sport with the return of interesting results. That report will be available on the Inclusive Sport SA website in the coming weeks. Later this month, Inclusive Sport will release the Well Played campaign with the message "Play Together, Play Well" to change the hearts and minds of the whole community, using social media to help people see the benefits of including people of all abilities in sport through stories like Isaiah's that you see on the screen now. You can visit the Facebook page Humans of Sport in SA for Isaiah's story and more. For the sport and recreation sector, Inclusive Sport met with key state sport administrators about inclusion of people with disability in club sport. By doing that, they found opportunities to share knowledge, provide training to the sector, and bring together the many already great resources available about how to improve inclusion in sport. They're now building an online hub where major sporting bodies, community clubs, service providers, prospective participants and their families can connect with each other and share supports, events, competitions and strategies that work. Have to keep my mouth working. For people living with disability, there is a self-driven participant advisory group of 6 local and high-performance athletes and coaches with lived experience of disability, as well as some resources developed by people with disability for people with disability. The advisory group's aim is to help the sector implement initiatives that take the views of people with disability into account. Inclusive Sport SA are working also with people with disability to make short videos on topics like how to deal with an umpire's decision, how to meet people at your club, and what to expect as a player. With outcomes and activities defined, a good ILC project also includes a way to measure how well each activity meets the outcomes. As online activities, Inclusive Sport's social media campaign and sector forum will have many measures built in, quantitative things. How many is easy to measure, but how well is more difficult. So Inclusive Sport are also using surveys at the start and end of their activities to measure how well they've delivered those outcomes. Remember, they were that people with disability have knowledge, skills, and confidence. And mainstream sport is better able to include people of all abilities. So qualitative and quantitative measures are the cornerstone of a good project evaluation. Above all, evaluation is a learning process. Inclusive Sport have designed activities that let them easily learn about and measure how many people engage with each activity, but also understand what's working and what isn't from the feedback they get online and in their work directly with people with disability and the sector. So we've now finished looking at the first of the ILC investment principles, evidence-based defined outcomes, and how different ILC projects are meeting this by using evidence to find a problem, find a solution, size the problem, define outcomes and design their activities, and measure the results of their projects towards those outcomes. In the end, what the NDIA will look for is some evidence that your project knows what it sets out to achieve and that it's aligned with those ILC objectives. That you've shown how the activities you'll do will achieve that outcome and that you have a plan to measure the results. The next investment principle the ILC is using is to invest in activities led by and for people with disability. All projects should include the voice of people with disability to make sure that the activities you do meet real needs. We've already heard about how Inclusive Sport is doing this throughout their ILC project when they're gathering evidence, when they're developing solutions, and when they're measuring how well things are working. In some ILC grant programs, like the Individual Capacity Building Program, the NDIA will be looking for applications specifically from organisations led by and for people with disability, or some of those priority groups that we discussed before, like Aboriginal and Torres Strait Islander people, different cultural backgrounds, and regional and remote areas, and LGBTIQ+. Some groups led by people with disability, or those priority groups, may be very small, unincorporated organisations. Because they're not legal entities themselves and might not even have a registered office, unincorporated groups can only apply for an ILC grant by working with an auspicer. An auspicer is a separate organisation who manages the grant money while the group delivers the project. We'll hear a bit more about auspicing in our next webinar. The next investment principle is to invest in activities that are replicable and scalable to national impact, a program with legs that can grow and be replicated elsewhere. In some programs, NDIA may look to fund ideas that can grow and spread to make the most of our investment, because it's our public money after all. That might be less important for some grant programs targeted to specific groups, but it's particularly likely to be looked for in the National Information Program and the Mainstream Capacity Building Program, because both of those programs are looking to improve things in big systems. The National Information Program is looking to create a nationally consistent information base. And the mainstream capacity building program is hoping to make change across the systems we all use. They're nationwide and similar everywhere. The inclusive sport projects that we saw are replicable and scalable to other states because the sports sector is similar everywhere. Autism SA's website that we looked at in webinar 1 at autismfriendlycharter.org is another example of a project that started in SA and is now available nationally. The fourth investment principle is to invest in activities that support a sustainable NDIS. Now, as we saw before, the NDIS is more than just NDIS plans. It's a whole system or scheme that works together to make a more inclusive society. So, your ILC project should complement but not duplicate the supports that are already available from NDIS plans, mainstream systems, and the work of partners in the community. Partners in the community include ECEIs, or Early Childhood Intervention Providers, and LACs, or Local Area Coordinators. The idea behind local area coordination is for each area to have a coordinator who helps people create the life they choose through their own network of support from friends, family, community, and support services of all kinds. It's an idea that started in Western Australia in 1988 and is also in use in the UK. If you're interested in the theory behind local area coordination, you can learn more at the links we're posting now. We spoke with one local area coordinator, Lee Spaven, from Baptcare about their role in the LAC, they are an LAC, about their role in ILC. So Baptcare are contracted by the NDIA to provide local area coordination. And as Lee said, that's about what is a good life as determined by the person with disability. As well as linking people with formal support, LACs help people find other opportunities to make a good life in their community. That includes working directly with people who've met NDIS access requirements to understand, navigate and access the NDIS, but also building the capacity of people living with disability to access government services and supports and participate fully as community members. They work with communities to promote social inclusion and opportunities, for example, through workshops and information sessions about the NDIS. So, as Lee shared with me, the ILC is an opportunity to grow a network of support throughout the community and all our service systems. The information, linkages and capacity building activities delivered by LACs and through ILC grant projects will complement the support people with NDIS plans receive. ILC is also very important for those 2.5 million Australians under 65 who don't need or get support from NDIS plans, but who will benefit greatly from mainstream and community services that include people of all abilities. For example, a person might not be eligible for an NDIS plan if they're not a permanent resident. An LAC could link them with support available through health, education, multicultural services and community supports. Some people with permanent and significant mental health issues may get an NDIS plan, but an LAC could also link anyone with mental health issues to community mental health and peer support. When planning your ILC project, it's a really good idea to find out what your local LAC is doing. That might help you understand where there are unmet needs, but also making sure your LAC knows about your project can help when they are linking people with support. If you think your LAC could play a role in your project, make sure you reach out to them early in the planning process. Don't assume what they can or can't do. Baptcare are the LAC for the East and West Metropolitan area, as well as the York and Mid-North region. You can find out who your local LAC is on the NDIS website, and we're posting a link to that now. The final investment principle is to fund activities that support important groups. Now, this will be a focus or optional depending on the requirements of each grant round. Some of those important groups are CALD, Aboriginal and Torres Strait Islanders, LGBTIQ+, and regional and remote areas. We already shared in our last webinar some projects supporting people from diverse backgrounds. There are also projects supporting SA's regional and remote communities and Aboriginal and Torres Strait Islander people. There was a remote round last year that provided funding to select organisations working with those groups, including a number of Aboriginal controlled organisations. And you can find a link to the full list of remote grant winners on our website. When you're helping an important group in a local area, it's a good idea to think about who is affected by the problem, who plays a role in the problem, and who might help in the solution. These are your project's stakeholders. We've already seen how inclusive sport is working with stakeholders from right across their sector, as well as people with disability in their ILC project. Some ILC projects are being done by consortia. A consortium is a group of organisations working together to deliver different parts of one ILC project. There will be a project lead organisation and then others who are helping. Some ILC projects helping important groups will also have a lot in common with other separate projects. So it's a good idea to look into what else is happening in your area for two reasons. First, you'll know if your project is needed or if a solution is already being put in place. Second, you might find opportunities to share resources and knowledge that will help make your project better. Here's an example. Though they speak many different languages and live in different places, culturally and linguistically diverse communities face some common barriers to participation. Some projects have joined up with others also looking to support culturally diverse communities to form the Northern Adelaide ILC Collective, a group of 8 ILC-funded organisations together with representatives from local, state and federal government. Disability is one part of a really complex mix of social problems faced by people in the Northern Adelaide region. So the members of the collaborative group have come together in a semi-structured partnership because they realise that solving these problems requires a joined-up effort. Having been awarded ILC funding for various projects targeting people from different cultural backgrounds, they came together to work out how they could work together and make a collective impact. They created a shared vision that services in Adelaide's outer north are more inclusive of CALD and Aboriginal and Torres Strait Islander people with disabilities. They've set up regular meetings and project groups that work on each of 4 common aims. They also offer each other in-kind support around activities that work towards their collective vision. Being part of the Northern Adelaide ILC Collective creates shared value in 3 ways. Members of the collective learn from each other's experience. They share resources, avoiding duplication of effort. And in that way, the community benefits because a joined-up approach can do more to make services more culturally inclusive. So collaboration has many benefits. The starting point is knowing who your stakeholders are. Collaboration can be as simple as reaching out to your local LAC and your community to understand the problem you want to solve with your ILC project and find a solution that will work. Or it could open the door to working together on a bigger goal of which your ILC project is just a part, like the Northern Adelaide ILC Collective. Whatever approach you take, working with others can help you learn, raise awareness of your project, avoid duplication and maximise your resources, and open the door to other opportunities. When you put in an ILC grant application, it's seen by a few different people. The Department of Social Services Community Grants Hub gets your application, checks that you're eligible, and then assesses your application against the selection criteria for that specific grant round. Applications that meet the criteria get passed on to the selection advisory panel. They make recommendations to the delegate, usually the chief executive, about which applicants should be awarded funding, how much, and with what conditions. The delegate then makes the final decision. There are a couple more steps too, and we'll look at that in more detail in our next webinar. For now, let's focus on the assessor, that person who'll be looking to see if your project meets the selection criteria. Before we do though, just a note of caution. This is a general summary only and is not official advice from the NDIA. If you are going to apply for a grant, it's really important to read the requirements in the official documents for each grant round. You'll find them, as well as the official feedback on previous grant rounds, by searching ILC on the Community Grants Hub. We'll be posting the link there now. The selection criteria are the key things that the NDIA want to see in each individual ILC grant. They're different with each grant round. With every ILC grant round, the assessors reflect on the applications they got and publish feedback about what made a successful application. If you weren't successful, you can read this feedback and maybe try again in a future grant round. We've read all the feedback from previous grant rounds here at CBB, and we picked out the key themes that we noticed. I think you'll agree we've seen many of these reflected in the case studies we shared today and in our last webinar. In summary, the key themes were looking for eligible activities and information on exactly where, what, and how much and how many and how long those activities will go for. Your capability, so evidence that you have the ability to evaluate, resource, and manage your project sustainably. They're looking for involvement of people with disability throughout design, development, delivery, and evaluation of your project, and some engagement with stakeholders and a plan to manage this. Now, the practicalities of doing some of those things we'll be talking about in our next webinar. Remember that at the end of the day, what the NDIA really wants from the ILC is the same things we all do, outcomes that will make it possible for all people, regardless of ability, to participate fully in their community as active citizens. If you haven't already, watch our first webinar in this series for more about ILC outcomes and to learn more about how any organisation can create a great ILC project. Book in for our regional workshops at cbb.com.au/ILC and tune into our next webinar. We're nearly at the end of today's session, still to come our live Q&A, but now it's your turn to talk. So using the chat window, can you share with the group 3 things? What one thing did you like best about today's webinar? What was one thing that you learned? And what's one thing that you'll do as a result of what you've learned today? Again, if the chat window isn't accessible for you, you can email ilc@cbb.com.au. Kirsten has an eye on the inbox and will be able to see and share your response on your behalf. To help you, here's what we covered today. We looked at the ILC investment principles and how some organisations are working to make sure that they have an evidence base and have defined the impact they'll create. We looked at activities by and for people with disability, either run by and for people with disability or including their voice throughout that process. Different ways that things can be replicable and scalable to national impact, supporting a sustainable NDIS, supporting important groups, collaboration, and finally, we ended off with looking at what assessors want. And what they really want, of course, is outcomes. So, of course, you don't need to share if you don't want to, but maybe take those thoughts away with you and reflect on them. It'd be maybe some good fuel for your own ideas. Oh, we do have something, a comment.
Yes, Michelle says she liked understanding investment principles.
Oh, thank you very much, Michelle. If you have any more questions about those, feel free to post a question now. And I'm glad to hear that you enjoyed that part. In a moment, we'll be starting our live Q&A. If you don't have a question yet, if you do stick around, you'll have a chance to listen in or join the discussion at any time using the chat window. If you're watching on the recording, you can still post a question because we are keeping track of that too. Click on questions to see and upvote other people's questions or post your own. We're now also opening a live poll. This is one way that we're measuring how well ILC Ready is meeting its outcome, which is to get South Australian organisations ILC grant ready. So before you leave today, please do take a moment to answer by clicking on polls at the bottom of your screen or emailing us. While you're posting your final questions, let's look at what's coming up next in the ILC Ready program. A few seconds after I end today's webinar, you'll be able to watch a replay right here in this crowdcast. We'll also be repeating today's webinar live again this Thursday and next Monday at 11 a.m, both times with another live Q&A. You can find replays of our last webinar, The Big Picture, on our website. We'll also make a transcript available soon. There's still more to come in our ILC Ready program as well. During August, we're visiting 6 locations across South Australia with a free workshop to help you learn how any organisation, big or small, can design and plan a project that's ready for ILC funding. If you're not sure yet whether ILC is for you, that's okay, because the knowledge and skills you'll take away can also help in other areas of your work. You'll learn about how to design any project to deliver social impact, how to plan and successfully deliver a grant-funded project, and respond to a grant application with confidence. ILC Ready is funded by South Australia's Department for Human Services through its NDIA Community Inclusion and Capacity Development Grant, which means that the webinar series and workshop is free for anybody to access. Applications are open from now until early September for a chance to be one of 20 organisations who'll be granted a fully funded package of support from our consultants to develop their ILC project idea. So please get involved and share our website cbb.com.au/ILC with anyone you think would be interested. So it's question time now. I'm going to switch over on my screen so that I can see the questions. We'll ask those. And also joining us is Lee Spaven from Baptcare. Welcome, Lee.
Hello, thanks very much for that.
No worries. Thanks for joining us. And I'm just going to get over to our question screen so I can see what people have posted. No questions yet. So, Lee, I think we'll just start off by having a chat, and anyone, if you'd like to post a question, feel free to hop in and do that. Lee, we heard a bit about what Baptcare does in its role as an ILC. I'm wondering, just from your personal perspective, what excites you most about the ILC grants program?
I think that ILC grants program offers that opportunity to broaden the National Disability Strategy out to the whole community and really involve the voice of people in a way that they would really like to have that happen, because I think, when we have a new Commonwealth program, there's that level of Commonwealth and engagement, and then it moves on to, so the LACs, we're a community organisations, but we are still working very closely with the NDIA, and then this is that opportunity just to be that little bit more broadly focused and really bring the voice of people and to really see some different innovative ideas and solutions to that community capacity building that comes directly from people who are on the ground experiencing this every day, have some really great ideas about what would make a difference in their life. And I think that's one of the really exciting things about it.
Yeah, fantastic. And obviously working, at the front line with as that main contact point, I gather you'd see how important that is to understand where people are coming from.
Yes, and when we speak with people, the things that people are hoping to achieve or want to achieve in their life, or their aspirations and goals, are really around the same things that everybody in the community has. And sometimes you sort of think, well, what are the barriers to that for you, and how can we really support the community to break down those barriers? Because individuals just need the community to support them with that. And I think it's that's the exciting part about this whole reform, really, is that opportunity to make a difference to our entire community.
Yeah, and it's a lot bigger than just specialist service provision as well. That gets me excited.
Yes. That's and moving it out of that specialist service provision and funded supports and into, what do I want my life to look like? And I know the NDIA language is around an ordinary life, but everybody's life is extraordinary because that's how they make it. So what are the opportunities for us to support people to lead those extraordinary lives that they would like to achieve through connecting and linking and being involved in community to the extent that they would like to be.
Yep. So speaking of those opportunities, I guess, in a future where we had achieved full inclusion for people with disability, how do you think things would be different? And what would that mean for our communities? What would it actually look like? What would be the changes we'd see?
So given that we think about people with disabilities and the things that would be required to make community more inclusive, really it would be just things that will make the community more inclusive and welcoming for every single person who lives here. So for me, it's that, what does a really vibrant, strong, inclusive community look like? And Australia's a pretty amazing place to live, but when we see this reform and start to see that inclusion agenda grow legs and really evolve, is when we will see our communities flourish, and some of those groups that you're talking about where they're the more targeted groups. So how can we make sure that everybody everywhere is able to experience the same level of inclusion or the same level of access to anything, regardless of where they've come from, who they are, because it's really about that being the best place that you would like to live. You're the best place that you would like to live for you in your circumstances, and that should be available to absolutely everybody with no barriers.
Yes. And I guess that's what we all have in common, regardless of our background or our ability, is those human needs to belong, be part of life.
Yes.
Yeah.
And so then it's like, what are the barriers? What are the things? And most of them, I think if we have a collective approach to it, we'll find that those barriers can be identified and we can overcome them because as a collective, we have a great voice.
Indeed, we do. Thank you so much for joining us today, Lee. We haven't had any questions. You've all been very quiet. If you are watching this on the recording, feel free to post a question and we can follow that up with an answer, because we'll be watching the chat window on each of our recordings as well. So thank you very, very much for joining us. Did you have anything else that you wanted to add, Lee, before we sign off?
No, I did see where you said, if you want to contact your LAC because you're thinking about how your project might sit alongside or link with the local area coordinators, my advice would be just to get in touch with us, because we're as excited about the ILC. We're part of the ILC framework, so we're as excited about this as you are, and would be really keen to explore how this could really support us to link people in who we're finding where there are gaps or they're asking us, what's available in our community? So do speak to us if you think that we would be able to add value to your project, or you can add value to what we're doing as LACs.
Wonderful. Thank you so much, Lee, and thank you to all of you for joining in and sharing your comments and questions today. A big thank you as well to our case studies, Inclusive Sport SA, the City of Playford with the City of Salisbury and Department of Human Services, Leah from Baptcare as a local area coordinator, and the Northern Adelaide ILC Collaborative Group. Thank you to all of you for sharing your projects and experiences with me to share with everyone today. So I hope you've all been inspired. Thank you for joining us, and we hope to see you at the next webinar in this series. Goodbye.